For an anterior strip crown, first measure the mesiodistal width of the tooth with the Boley gauge, or perio probe to select the appropriate crown. We will be using URC2, which is for the upper right central size 2. Here's what an untrimmed crown shell looks like. Hold the crown form against the tooth to ensure their incisal edges match. This ensures the mesial distal width of the crown will match the original width of the tooth. Set up your rubber dam. You may place the clamp on the canine and extend the split dam a few teeth past the tooth you are working on. Start your prep by reducing 1 to 1.5 millimeters incisally with a 169L or a tapered diamond burr. Reduce into approximately 0.5 to 1 millimeter and break the contacts. Reduce 0.5 to 1 millimeter labially and lingually. Prep slightly supragingival with knife edge margins. The crown form will fit slightly subgingival. Round line angles as well. When working with the crown shell, the side with the tab is the facial side. The lingual anatomy is visible on the opposite side of the tab. Here you can see the crown portion of the shell, and right here where the crown cinches in is where the root starts. This is the portion you will need to trim off. Begin trimming your crown shell with small, curved scissors. Make sure to do so very gently to avoid fraying. First, you may make a small snip interproximally. Then, while holding onto the tab, trim all the way around the shell to remove the collar. Trim the tab off the crown shell. Also, place a hole in the lingual of the crown form with a small round burr. This form still needs more trimming, however, as there is still root on it. You can also try to remove any frayed edges. Next, ensure a passive fit of the crown shell. Check to see if there is enough reduction facially, lingually, and incisally. This form does not seat completely, so the prep will need modification. Now there is enough distance mesially, distally, and incisally to get enough buildup of composite. Dry the crown form. Ensure that no voids and bubbles are in the form by filling directly at its incisal portion. Fill it halfway with composite. You may also use the instrument that has a paddle on one side and a condenser on the other to condense the composite and avoid voids. Leave a small space in the middle of the composite to make room for your prep. Check for voids or bubbles on the incisal edge. Rinse and dry the prepped tooth. Etch and place bonding agent on the tooth. Place the crown form on the prep gently. Do not squeeze or force the crown on the preparation. Orient the crown. Evaluate it in facial, lingual, mesial, and distal positions. Remove excess composite around the gingival margin with an explorer, holding the crown form in place with a light finger pressure. Do not worry if the incisal edge is long, because you will be able to adjust that later. Light cure for 60 seconds on both the facial and the lingual. Remove the plastic shell with an explorer or spoon excavator. You can get underneath the crown form or use the hole to remove it. Adjust and reshape as needed. Remove flash near the gingival margins. Check occlusion, especially on the lingual, and adjust.